Hi everybody, it's Dr. Cary Yurkiw here. Thanks for joining me for this live broadcast on chiropractic. What is the main idea? And often people ask that question, how did chiropractic start? What is it? And they're trying to figure it out because they've never been to a chiropractor. They may have heard things about chiropractic. They have some fears or concerns, and they really want to know how it works. So the difference between chiropractic and other professions is, when you're young, you might go see a doctor or a dentist and you're familiar with your family's doctor or dentist, but for chiropractic, some families don't have a chiropractor as their family chiropractor. It's becoming more and more common now, but I think that leaves people a little bit in the dark, and then they want to figure out, when do I use a chiropractor? How does it work? Is it safe? All those types of things. So today I'm going to go over that. I've been practicing for 29 years. I'm just going to flip my slides here on YouTube. So I've been a chiropractor for over 29 years, and I practice in Kelowna, that's in British Columbia. And we are accepting new patients at the clinic. So if you're in the Kelowna area, please contact me. And if you're not and you want to see a chiropractor in your area, just comment below or DM me, and I'd be happy to help you. Also, you can follow me on social media and on YouTube. I'll give you more details towards the end of today's video, but I want to get right into chiropractic. What is the main idea? And chiropractic's been going on for a long time. I mean, if you look back in literature, chiropractic adjustments were being done thousands of years ago. And, when somebody had a pain in their spine or in the joint, one of the things was to put that joint back into place. And so chiropractic has been going on for hundreds, if not thousands of years, and it just wasn't formalized as a profession. And more recently, in 1895, chiropractic became what it is today. It's started that formal period of defining chiropractic as a profession. And then the principle behind chiropractic at that time was a bone out of place, or what we call a subluxation, was causing pain, discomfort, interference to how the body worked. So I'll tell you about that in a minute. So really this new formal period of chiropractic started in 1895. So what is the main idea behind chiropractic? Well, the main idea behind chiropractic is a bone out of place interferes with the nerve flow. So the brain is connected to the body through the spinal cord. If one of the bones in the spinal column's out of place, it interferes with the nerve flow. Makes sense. And then that affects the organ function, it affects the muscle function, it affects wherever those nerves are going. And there's nerves going to the tips of your toes, to the tips of your fingers. There's signals coming back from those areas back to the brain, and there's a ton of reflexes going on in the body. Some of them you don't even have to think about. We call them autonomic nerves, where it's just like a regular nerve flow going through to your heart and your lungs so you can breathe, your heart rate, all of those things. So a bone out of place or a subluxation interferes with the nerve flow, and then the body's weakened. So you don't have as much nerve flow going through, and that can cause weakness in that area. Now you might not even notice that initially, but if the weakness is profound enough, or if it goes on long enough, then you can start to notice some symptoms. Sometimes the symptoms are very centralized, so they're where the bone's out of place. Sometimes the symptoms are down the line. So in a case like sciatica, the symptoms are going down your leg, right? Or if you have a pinched nerve in your neck, it's going down your arm. So these symptoms can be related to that bone out of place, but can actually be quite far away from where the bone's out of place. Sometimes I use the analogy in the clinic, it's like a rock on a garden hose, just for simplicity. The rock's on the hose, but really the flow's not coming into the end of the hose, and you're looking at the end of the hose and you're thinking, where is the water? But meanwhile, the problem is way up the line. So as a chiropractor, what we want to do is restore the function in the body, and we're going to look for any bones out of place. We call them subluxations, and then we're going to do adjustments to restore the nerve flow. And these adjustments are done in a number of different ways, and that's kind of evolved as the years have gone on. So these adjustments at the beginning were primarily hands-on adjustments. Most of the adjustments early on, 1895, even going into the early 1900s, were done on the upper part of the spine, on the atlas, so the upper cervical region, C1. And the reason was because the first adjustment was done there on C1, the atlas, and that adjustment made such a big difference to the patient that early chiropractors focused primarily on that segment. There still are chiropractors that do upper cervical techniques that still focus on that first vertebrae, the atlas, and it does, from my experience, that atlas is one of the most important vertebrae in the spine because the brain's coming down and tapering into a brainstem. That brainstem comes through the hole in the skull called the foramen magnum, and you have a really thick spinal cord up in the upper cervical region close to the brainstem. So that C1 is very important. Now, chiropractic has evolved since then. So as the years went on, different techniques started to emerge. So other parts of the spine were getting adjusted, the lower cervical area, the mid-back, thoracic, the lower part of the spine, the lumbar, even the sacrum and sacral techniques. So really, chiropractic evolved from there. So there's a number of different techniques that are done in chiropractic, but hands-on adjustments are still very prevalent in how a lot of chiropractors do their work. There's instruments that do adjustments. I personally use an activator and an integrator. These instruments, the activator being a little bit older than the integrator, but both techniques work to realign and restore the tone in the body. And then tables, like drop adjustments for the hips. Some chiropractors do drop table adjustments for the cervical or the thoracic. So this is how chiropractic is practiced today. Now, what other modalities do chiropractors use? Well, we use x-rays in the clinic, and chiropractic has had x-ray for a long time. I don't know if it's been as long as x-ray was invented, but chiropractic was one of the early adopters of x-ray because x-rays do show you the alignment of the bones, the condition of the bones, the spacing of the vertebrae. So x-ray was very important to chiropractic and still is today. A lot of chiropractors use x-ray for diagnosis, and some chiropractors use x-ray to follow up on the progress of the patient to see, actually see the restoration of posture and alignment and function in the spine. So we have digital x-rays in the clinic, and that's a technique that I use for my patients. There's also other techniques chiropractors use, like I use shockwave, laser, and decompression. These are techniques that help the adjustments, help to repair the tissue. So they're kind of an adjunct to what we're doing in the clinic. They're assisting the work we're doing, speeding up the healing process, improving on that healing process. So just like ice or heat, there's different modalities we can use to help the healing process, and of course giving the patient the right advice to take home with them. So some of that advice can be things like stretches and exercises. Some of that advice can be things like strengthening, nutrition, lifestyle, posture. So all of those things are really important too for the healing process in the body. So if you guys have any questions, please type them in the chat here on YouTube as well as on Instagram. If you'd like to follow me on social media, it's at Dr. Cary Yurkiw, pretty simple. And I'm on Instagram, Facebook, and Twitter, TikTok as well. If you want to get these live videos and you want to see more educational slides, you can subscribe to my channel on YouTube. We are seeing a lot of growth on YouTube right now, and it's because of these types of videos. So subscribe to our channel on YouTube and you'll get updates as to when the next video is going to be, the live video or the recording. Right now, Monday, Wednesday, Friday, we are doing these videos live at 9 a.m. Pacific. So please join me here. Our podcast is called Super Healthy. It's on Spotify, Google, and Apple. And you can listen to this or even view it because there's a video podcast now. So if you're on Anchor or Spotify, you can get the video replay of this live YouTube stream. So please subscribe to our podcast channel. And last, which is something new to us, is Twitter Spaces. So I've started to do Twitter Spaces. It's really a ton of fun. It's a place where people can join us on Twitter. You just have to go on Twitter, look up Spaces, and type in, you want to type in my name, type in Kelowna Chiropractor, or you can go right to my profile and you'll see that I'm on a Twitter Space at the time because the profile picture changes color. So Twitter Spaces is a ton of fun, and so we're doing that 2 or 3 times a week right now just to keep people in the loop, and it's all revolves around this topic. So today, you know, Twitter Space will be on this topic. We'll be discussing that, taking questions, and just kind of getting the word out about the main idea of chiropractic. If you're interested in coming to the clinic, I am accepting new patients. You can certainly reach out to me. You can comment or DM, and I'll get back to you. Just DM new appointment if you want to come into the clinic, and I'll know what it's about. If you're not in our area and you want to see a chiropractor, just reach out to me and I'll find you a chiropractor in your area that does this type of work, and then I'd be happy to help you. So thanks for joining me today. Please join me again Wednesday morning at 9 a.m. and we'll be talking more about chiropractic, how it works, and the different types of techniques that we use, the different treatment modalities, different examples of chiropractic and how it works. Thanks very much for joining me today, and have a great day, you guys.